Hello everyone, my name is Ramandeep Kaur and today I am going to be talking to you about the future of robotic surgery and the breast cancer imaging technologies. Let's start off with robot-assisted surgery. So the robot-assisted surgery is an application of computer-assisted robotics to enhance surgeons' capability to carry out various minimally invasive surgical procedures. There are two types of robots used in surgery: passive robots and active robots. Passive robots are controlled by physicians, and active robots are controlled by computers. The following slide is a comparison of both advantages and disadvantages attributed to the uses of robotic surgery. The advantages: with robot-assisted surgery, physicians have witnessed that the patient experiences faster recovery and a decreased chance of morbidity overall. Patients report having less pain. According to Dr. Douglas Boyd, an average hospital stay is 2.8 days for robotic surgery patients. The patients do not bear a long surgical scars on their bodies. There are also disadvantages. Currently, the major drawback of development of robot-assisted surgery is the time latency, which is time delay between instructions issued by a surgeon and the movement of robot which responds to the instructions. Robot technology is extremely expensive in terms of running expenses as well as the capital cost. The next topic I will cover is breast cancer. Here's a little background knowledge. Breast cancer is the most common cancer found in women, and it is the second leading cause of cancer death in the United States. Breast cancer is most effectively treated when detected at an early age. Next, I'm going to talk about the imaging technologies that have been used to detect breast cancer for the last few years. The first one is mammography. A mammogram is a low-dose X-ray of breast tissues. A screening mammogram is done if a woman has no breast complaints. When a woman presents with a breast problem or has a family history of breast cancer, a diagnostic screening mammogram is done. It is the most common imaging technology used to detect cancer. The second one is MRI. MRI has become a valuable adjunct to mammography and ultrasound. With MRI, physicians can accurately assess the stage of breast cancer. MRI can be used for both diagnostic and screening purposes. The last one is breast ultrasound. Ultrasound is relatively low cost. The advantages include the ability to provide real-time imaging guidance for procedures. Ultrasound is primarily used as a diagnostic tool, not as a screening tool. Breast cancer imaging alternatives. PEM and PSGI are two recent technologies introduced for imaging. PEM PEM are scanners that are high in resolution. The most reliable way to identify lesion is to combine the PEM and MRI technologies. The next one is BSGI. BSGI is another molecular breast imaging technique that can visualize lesions independent of tissue density. BSGI is a high resolution and a small field of view gamma camera. It is considered most effective than MRI. To conclude my presentation, it is evident from the reading that robot-assisted surgery is here to stay. I found that there are some concerns that need to be addressed before implementing robotic surgery, such as it is relatively new technology that requires advanced skills that are not usually taught in residency. Another issue is that robotic surgeries are quite expensive and not everyone can afford it. But I do fully support the alternative used for breast cancer imaging because these advanced imaging technologies give physicians many options to detect and diagnose diseases at an earlier and more treatable stage. Advanced technology offers exams and greater comfort and safety for patients. Here are my sources, and thank you for watching my presentation.